Hi, I'm Daryl McIntyre. Welcome to our latest conversation. We are focusing on companion animals in this session, part of a series we call Raised with Care, the Stewardship Sessions that we're presenting on behalf of the ABVMA. And today's conversation, as I mentioned, is on companion animals, and we're hoping to get a lot of uptake and a lot of people watching and commenting and asking questions. We are doing this through live stream, going through both YouTube Live and Facebook Live. We'll be talking about animal issues that your pets may face and talk about prevention strategies as well and things you can do to try and ensure the health of your beloved pet. So we'll be talking about that. We'll talk about how a relationship with a veterinary team can make a huge difference in the health of your pet, but also how ensuring that there's a good relationship right off the bat can end up helping your bottom line at the end of the day. As we've seen with all of our Raised with Care stewardship sessions, there's been a common theme that prevention is a lot cheaper than treatment at the end of the day. So that is something we do like to talk about. And again, if you want to be involved, we'd love you to do so. So if you are watching this in the live stream, you can comment through YouTube Live or Facebook Live, and then I'll pass along some of your questions to our guest today. If you do want to be notified of the next session, and there is only one more session after this one, just subscribe and click the notification bell on YouTube Live, or you can leave a comment and a like through Facebook, and you'll be able to get a heads up about the next session. And next week, we'll be talking about small ruminant animals, so sheep, goats, llamas. We'll be focusing on all of those. And if you want to see any of the past sessions, they are all recorded and all available on the raisedwithcare.ca website. You can simply follow the links and you'll be able to get access to some of our previous conversations. Okay, today, as mentioned, we're going to talk about companion animals. Here are a few stats that I certainly wasn't aware of before we started going through and doing some research. Obviously, we know that there are a lot of companion animals, a lot of pets. 90% of the time we end up talking about dogs and cats, and there are a lot of them. Just some recent numbers, and these aren't really current. This is from August 2016, but as of then, in Edmonton, there are more pets living in the city than there are children, people under the age of 19. So maybe some childless families that have 4 different pets. So maybe that pumps it up. There was a report from Global News saying 195,000 cats and dogs in the city. So that's more than the 189,000 children, people under the age of 19. In Calgary, tons of cats, 91,550 in 2010, and dog ownership basically doubled with the population from about 70,000 to double that in 2016. So there are a lot of dogs and cats, but we also don't want to forget many of the other companion animals. There can be the pocket pets, rabbits, or not rabbits, that'd be a pretty big pocket pet, but gerbils, guinea pigs, reptiles, birds. There's a lot on this plate. So we needed to bring in a guest to be able to cover that all off. And his name is Dr. Danny Joffe, joining us live. Thanks. Appreciate it. Nice to see you.
Thanks for having me.
You ready for this?
You bet.
Absolutely. Well, let me just give everybody who's watching just a bit of background on some of your credentials. Graduated from the Western College of Veterinary Medicine in Saskatoon. I graduated with great distinction in 1985. Completed an internship at Cornell University, 85-86. Eventually started his own small animal practice, Landing Animal Clinic in Calgary in 1989, and practiced there right through to 2020. He was a founding partner in a multi-specialist referral and emergency clinic in Calgary. That was in 2006. Was the medical director at this 22-doctor facility until the fall of 2010. In the fall of 2012, Dr. Joffe became the national medical director for VCA Canada, Canada's largest group veterinary practice, and completed his board certification by the American Board of Veterinary Practitioners Canine Feline Specialty in 1992. So made him the first practicing veterinary specialist in Alberta. Also a past president of both the Alberta Veterinary Medical Association and the Canadian Academy of Veterinary Dermatology, and a clinical instructor at the University of Calgary Faculty of Veterinary Medicine. So all of that tells me you either know what you're talking about or you've been faking it brilliantly since 1985. I'm going to go with the former.
Could go either way.
Could go either way. How much hands-on, just to give us a little bit of a setup, how much hands-on practice are you still doing? Are you doing a lot of sort of managerial stuff, or do you still get to go into the clinic and actually treat animals right now?
Well, unfortunately, in the spring of this year, I stopped working at my general practice at Landing Animal Clinic because my other job had gotten too big.
Yeah.
I still do some work at the referral clinic, the care center in Calgary. I share the ultrasound load there with our radiologist. So I still am on the floor, Not as much as I would like to, but I enjoy what I'm doing as the vice president of medical operations as well.
Absolutely. There is always change as we continue to go through, and it's not like you hadn't done it before. So certainly there's lots to draw upon. Let's just talk about some of the major health issues that are facing some of our companion pets. We might as well start with dogs and cats because they tend to be the most prevalent. So for dogs, what's the most common type of ailments that we might run into?
Sorry, I just have to turn my lights on here.
Yeah, well done. Are you just waving to an audience that you haven't shown us yet?
I'm not dancing. I'm not having a seizure.
What's funny before we get going in here, the same thing happens in our studio. Sometimes if we don't have somebody walk around, then the lights suddenly go out. So maybe we'll just replicate what you just did here in a few moments. Anyway, let's talk about some of those health issues. Let's start with dogs first, some of the more prevalent ones that you end up seeing.
Dogs, probably the most common emergency visit is for gastrointestinal upset, vomiting or diarrhea. And that can be caused by many different things, some very serious, some they just got in the garbage and ate something that didn't agree with them. So that's probably by numbers the most common. The next thing would be dermatological disease, skin disease. Dogs and cats are very prone to allergies, the same kind of allergies that give a person hay fever or give a person intestinal upset if they have food allergies. In dogs, both environmental allergies and food allergies tend to lead to skin disease, and it causes inflammation of the skin, makes them itchy, makes them very uncomfortable. But often, secondary to the itch and to the inflammation, they develop secondary bacterial skin infections, and those can be quite troublesome. So if you said what are the two most common reasons for showing up at a clinic, I would say gastrointestinal upset and skin disease.
Well, in a lot of these sessions, we've been talking about antimicrobial stewardship, talking about the use of antibiotics and trying to reduce the number of instances where they're used and just try to target them. Otherwise, as we've all learned, that there is resistance to bacteria that can be created. So with these allergies, if you're able to get to it and treat it somehow before it becomes, or prevent it in the first place before it ever becomes a bacterial infection, that has to be key, right?
Yeah, but unfortunately, we usually realize that it is allergies after they've had 2 or 3 skin infections or ear infections, because we always just treat, especially if it's something mild, we say, well, let's treat it. Maybe it's an unrelated infection. Let's treat it. And if it comes back, then we'll start thinking, okay, maybe there's an underlying cause like allergies. Now, allergies can be cured, but it's not easy. Most of the time, we use various modalities to get the pet to live better with their allergies, with fewer flare-ups and fewer secondary infections. But skin disease in dogs and cats is probably on the small animal side where we abuse antibiotics the most. Now we're learning and we're moving away from that, but we didn't used to think that we had the bad resistant bugs that people get. Probably everybody's heard of MRSA in people, methicillin-resistant Staph aureus. Now, a similar bug, a cousin of that, is called MRSP in veterinary medicine, methicillin-resistant Staph pseudointermedius. And for years, MRSA was in the human population, first in hospitals, and then in the community, and they started seeing it in the community. And veterinarians, and especially I have an interest in dermatology, we'd sit back all cocky and say, they don't know what they're doing on the human side. We don't see any methicillin resistance. Well, we kept saying that until 2006, when it was first identified that we had both MRSP and MRSA in our veterinary subjects. But it's interesting, we didn't learn our lessons. At first we said, oh, that's only in dermatology practices. That's only where they see dogs that have been on 12 different courses of antibiotics. We're not going to see it in the general practice setting. Well, I did a study with a group of others in 2015, and we cultured bacterial infections, first-line bacterial infections, skin infections in dogs in general practice setting, and already 12% of those infections were methicillin resistant. So all of a sudden we realized that it wasn't that we were better than the physicians, it's just that we had used enough antibiotics and created enough resistance that now it's caught up for us too.
Yeah, you basically caught up.
Yeah.
So how do you treat these allergies and the subsequent infections without antibiotics, without having to use targeted dosages of antibiotics? Is there a way to be able to treat that without going down the antimicrobial pathway?
Yeah, so as far as treating allergies, we can, if we diagnose that it's an environmental allergy, we can give allergy shots, for lack of a better term, like they do for people. And about 40% of the time, we can significantly relieve the allergies in that patient. We also have new medications that have come out over the last 10 years that give us a bunch of better options at managing these pets medically. In the past, the only drugs that we had that were really effective were various cortisone type drugs, which could help with the inflammation and the allergies, but they have a whole lot of other side effects, very serious side effects. But we've had 3 new families of drugs in the last few years that have really helped. So our goal when we have an allergic pet is to suppress the allergies so they don't get that inflammation and they don't get the secondary infection. Unfortunately, a lot of dogs and cats still get secondary infections because we can't control their allergies well enough. What we've learned there, when it makes sense, when a pet has a bacterial skin infection, it makes sense to use antibiotics. Well, that's in overuse of antibiotics, that's where we started to see the resistance. More and more dermatologists and general practice veterinarians with an interest in dermatology have gone away from antibiotics, except in very deep infections, and they're using antiseptics. Antiseptics like chlorhexidine, which we can put in a shampoo, and we can shampoo that dog daily for a week and then every 3 days, and we can cure most of those infections with a shampoo as opposed to having to use an antibiotic. Now, in Alberta, in the middle of winter, and you tell a client that you have to bathe your big furry dog once a day for a week, sometimes that's not as easy and compliance isn't great, but that's a much safer way to do it. And veterinarians are moving way in that direction and saving the antibiotics for the deeper infections where we really might need them.
Well, and as a pet owner, all I want is my pet to be better, right? So if I come into the vets and my dog has a gastrointestinal problem, it's vomiting or diarrhea, or has a skin infection, all I want is to get it fixed. So antibiotics tend to be where we jump down and say, what kind of pills can you give to make my animal feel better? As owners, can we expect a bit more of a pushback now from most veterinarians as far as antibiotic prescriptions are concerned?
I hope so, but I also think we have a ways to go. That scenario where that dog comes in and we know how your bond to your dog is very tight. We want to get that pet feeling better right away. There's an antibiotic called metronidazole that's quite an important human antibiotic, but historically, we've given dogs with non-specific gastroenteritis, diarrhea, some vomiting. We've used that antibiotic. It was almost routine. They come in for that, we send home a prescription, and invariably, 3 to 5 days later, the diarrhea subsides. Yeah. Well, could well be that 3 to 5 days later, the diarrhea would have subsided even without the antibiotics, but it's a bad habit to break, especially when clients have had 7 cases through the 7 episodes like that, and all of a sudden the veterinarian says, you know what, I don't want to give you the antibiotic this time, right? But there are alternatives there. We have other medications like probiotics, proteobiotics, and prebiotics that we use in place of an antibiotic.
Now, obviously, there anytime you take your pet to a kennel or to a daycare or something, you have to have all of your shots set up. So I'm going to skip over a little bit about some of the vaccines, because I think that's a pretty common expectation that you need your animals to get their shots. Is that not fair?
Yes, they should. There are anti-vaxxers on the veterinary side, just like there are on the human side. Luckily, it's a small percentage because there are potentially fatal diseases for both dogs and cats that are floating around out there. For dogs, the 2 most serious diseases are parvovirus and distemper. And those viruses are around. We have a pretty robust coyote population in the province, and those pathogens are common in the coyotes. And our dogs, if we take them to park areas, they're commingling with the coyotes. And if they're not vaccinated, there is a good chance that they will be in touch with these viruses that are potentially fatal. So we recommend core vaccines are distemper, parvo. There's something called adenovirus that's in the same vaccine, as well as rabies, because rabies is we don't see a lot of rabies, but it's a potential fatal canine, feline, and human disease. So those are the ones that we really, really strongly recommend that we vaccinate for dogs. There are other, what we call non-core vaccines, and that would be one for what we used to call kennel cough. I call it the disease previously known as kennel cough. Now it's called Canine Infectious Respiratory Disease Complex, or CIRDC. And that's a vaccine that we call a lifestyle vaccine. So if you have a little dog that never leaves your backyard, it probably doesn't need that vaccine. Okay. But if you go to kennels, to dog shows, to parks, to puppy daycare, then those dogs are at risk for that, and they should be vaccinated for that as well.
No. Clearly, we could talk about dogs for a long, and I do want to touch on one more thing. When you talk about interaction with coyotes, it's not necessarily even the direct interaction, but it could be the coyote feces, the scat that might be left behind, and a sniff, or that's the same thing as an interaction.
Yes, it is, and there's an emerging infectious disease called the worm. It's a tapeworm. It's the fox tapeworm, but the fancy name is Echinococcus multilocularis, and that's it can be carried by dogs, foxes, and coyotes. And dogs, foxes, and coyotes are the definitive host. And what we mean by definitive host, they're a host in which that tapeworm can go through its entire life cycle in that one species, and the dog, fox, or coyote can poop eggs out into the environment. Now, why it's so dangerous is those eggs in the environment, most often in our area from coyotes, if a person or a dog ingests an egg, and that can be by mistake. If you have a garden and you don't have an enclosed yard, and a coyote pooped in your garden late winter, and by the time spring comes, you don't even recognize that there's fecal material there. It's disintegrated basically, and you plant some carrots and pull a carrot out, and there's an egg on there. You can ingest that egg. Dogs, if they find poop somewhere, they'll lick it, they'll eat it. They're not the most fastidious of animals. And people and dogs that ingest an egg can develop the intermediate phase of that disease, which is called alveolar echinococcus, where they get these big cancer-like cysts, most often in their livers, sometimes in other organs, and that's a potentially fatal disease for both people and dogs. We've seen about 7 cases at the referral facility in dogs in the last year and a half. So we're probably at the tip of the iceberg for this disease.
Because I also understand there's there can be a long incubation period too before you actually see it. So that, if you're talking years, it may not show up for a while. So it could be that tip of the iceberg, right? So
yeah, it can be 10 to 15 years or more before it's discovered. And what happens most often in people, they're doing an MRI or a CT scan for some other reason, and they see these big cysts, and there's no treatment for it, or minimally effective treatments.
But prevention is just being aware, washing any of your vegetables, that kind of thing, trying to keep your animals from interacting with any of that. Do wormers help? Because like you said, it's a tapeworm.
Yeah, so the only way dewormers help is if you have a dog, you don't want your dog to shed the organism. The only way the dog would shed the organism would be if it hunted and ate an infected rodent, and then it could go through the life cycle in the dog, and they could poop eggs into the environment. Okay. So if you have a dog that goes to areas and could hunt and ingest rodents, okay, then they should be on a medication monthly called praziquantel, and that, if we give that monthly, it will prevent them from shedding into the environment, but it won't prevent that fatal cystic form of the disease.
Okay, we have to get to cats. We've been talking dogs. We said companion animals, but we've talked quite a bit about dogs, and we'll come back to some of this stuff, especially some of the zoonotic diseases. I'd like to talk a little bit later about the potential transference from animals to humans, or vice versa, I suppose. But cats, major problems. You've already touched on some of them that is similar to what dogs are.
Yes, similar to dogs, not as much skin disease in cats as there is in dogs, but there is some. Gastrointestinal upset, very common. Vomiting and diarrhea, that would be the most common presentation of cats. Cats get a lot of upper respiratory infections, so colds, and there's a couple of viruses and a bacteria that can cause that, where they get runny eyes, runny nose, sneezing, and we see that a fair bit. Cats are quite prone to urinary tract problems. Some of them are infections, it's bacterial. Some of them are not, it's just stones and debris causing blockages in the urinary tract. But bladder infections in both dogs and cats is another area where we use a lot of antibiotics. And especially with cats, a lot of those problems are not bacterial diseases. So we should really stay away from the antibiotic unless we've run a urinalysis and can see that there actually are white blood cells and bacteria in the urine. So that's another area on the cat side where antimicrobials can be abused at times.
Yeah, and the vaccinations are important for dogs, but for cats, a lot of people will let their cats outside as well as keeping them inside. And I suppose if they're inside, then they're somewhat sheltered. But if you have a cat that goes outside, or perhaps your cat comes in contact with other cats that may or may not be vaccinated, that can be an issue. So you really do need to make sure those vaccinations are in place. Does that includes indoor cats as well? Outdoor, it seems fairly obvious to me, but indoor also important.
Yes, it is. It is important in indoor cats too. The most dangerous virus that cats get is feline panleukopenia, which is a distemper form in cats. And we can vaccinate against that. But you're 100% right. A lot of people with indoor cats say, well, I don't have to worry about it. But it's a pretty hardy virus. And if you're at somebody's house and they have a cat, you can pick up the virus on your pant leg and bring it home to your cat, so they can be at risk. Rabies, again, we do strongly recommend in cats, even indoor cats, because we never know when they could get out. Or bats are one of the species that carry rabies in this part of the world, and it's not unheard of for a bat to get into the house. And I know in my house, when we had a moth in the house, it was our cat's one chance to hunt in its wild kingdom, and they will kill and ingest something that's flying around the house. So rabies is important too. The other important virus in cats is feline leukemia virus. That's a disease that actually can cause leukemia, and there is a vaccine for that. But that virus is a wimpy virus, and you wouldn't, if you picked that up on your pant leg, it would die before you got home. Okay. So that one is not necessary for indoor cats. It's only necessary for cats that go outdoors.
Okay. We're going to talk more about some of the other issues with cats, but it is companion animals we're talking about. So I'd like to at least touch on some of the other ones. So birds, for example, lots of people have birds in their homes. Are there vaccinations? I've never owned a bird, so I'm not sure what the health protocol is for when you own a bird.
And I'm a little out of my comfort zone there as well. As far as I know, there are no routine vaccines for birds, but they do get sick and they'll get infections just like dogs and cats will. And occasionally antibiotics need to be used in birds, in reptiles, in bunnies. There's a lot of bunnies kept as pets now as well. Yeah. And they have some unique issues with antimicrobials, because there are certain antimicrobials that are very safe in cats and dogs, but if you give it to a bunny, it can change their intestinal flora so much that they can get very ill and even die just from being given the wrong antibiotic. So okay. Yes, those animals all have their unique problems as well.
We have lots more ground to cover, but I just want to remind any of the people who are watching, if you do want to throw in a comment or a question, you're more than welcome to, and we'll get Dr. Joffe to deal with it as best we can. So let's go back to the zoonotics that I want to talk about, because there are different kinds of things that can transfer from people, I would assume from people back. What kind of things do we need to watch out for, and how do we prevent them?
Well, we know now that 75 to 80, and some people even think higher percentage, so about 80% of new diseases that we detect in the world and in people are zoonotic in origin. In other words, they come from an animal. COVID-19 is a perfect example of that. It's assumed that it came from a bat. And bats are pretty good incubating chambers for them. Pigs as well. Influenza is a zoonotic disease, and pigs are a good mixing chamber for the various influenza virus. So those are viruses that we're very familiar with and are definitely zoonotic. SARS, a few years ago, another zoonotic disease. There's another coronavirus that causes Middle Eastern respiratory syndrome, or MERS, that's a zoonotic disease. So most new diseases in the world are zoonotic in origin.
How many of these are with cats and dogs? So how many, as we talk about some of the other...
With cats and dogs, very few, actually.
Okay.
So cats and dogs at this point have few zoonotic diseases. Probably the most important zoonotic diseases that involve dogs and cats is rabies. And that's why we so strongly recommend that they be vaccinated against rabies.
But you can have some issues with salmonella as well, right? And different kinds of tapeworms. We talked about the ones with the coyotes and the rodents and the dogs and that kind of thing. So there's some elements there. Salmonella, how would you possibly contract or get that from your pet cat or dog?
Yeah, and so salmonella, getting salmonellosis from your pet would be considered, it is zoonotic, but it's not an infectious disease. Okay. You become contaminated with it instead. And the area where that comes in is from feeding raw food. And raw food, it's been a fad since the early 90s that we should feed our dogs and our cats raw food. They should eat like they would have eaten when they were in the wild. And there's lots and lots of controversy around it. And I certainly am on one side of that argument. But one thing that we know 100% for sure is that dogs and cats eating raw food can shed salmonella into the environment, and people can then pick up the salmonella from the environment, and they can become infected. And there have been documented cases of death linked to the feeding of raw food. And so that is a big issue. The other thing that's been linked to eating raw food is increased antimicrobial resistance. The dogs, because what happens is there's bacteria in the raw food, most likely from contamination at the slaughter plant where the food originated from. If we cook that, it kills those bugs. It's not an issue. But if we don't cook it or don't irradiate it and it's ingested, then just have
yeah, I know. I knew it was going to happen.
Sorry, you're like right. Back at you. And so, what happens when they ingest the bacteria goes through the dog's or the cat's intestinal tract, and it can pick up more resistance from the normal bacteria in the intestinal tract, and those bacteria, by the time it's pooped out, can be more resistant to antibiotics. It has more antimicrobial resistance at the back end of the pet than it did at the front end going in. And there's good studies. One of the best studies on this was a study in England where the researchers looked to find dogs that had never been to a veterinarian, so they could never have been on an antibiotic. And they found 73 dogs, they were all Labradors, who had never been to a veterinarian, never been on an antibiotic, never been vaccinated. They were all on raw food, and they cultured stool from these dogs, and all of them had some very, very serious bacteria that had resistance patterns. And in fact, half of the dogs had bacteria that were resistant to at least 3 families of antibiotics, and that defines that they're very. Now I did too. That defines multi-resistant bacteria. Okay.
Go ahead. Make it come up. There we go.
So that defines when they're resistant to 3 or more bacteria, they're considered multi-resistant, and about half of the dogs had that. So raw food feeding is very popular in Alberta, but there is that risk that you're potentially contaminating the environment. We did a study, I did a study with a group at the Ohio State University where we found families that were feeding raw food and families that weren't feeding raw food, and we got them to bring in their vacuum bag when it was full, and we cultured the vacuum bags. In the homes where they were feeding raw food, there was 250% more salmonella found than there was in the homes where they were not feeding raw food.
Well,
So that's not technically a zoonotic.
No, go ahead. Yeah, it's not technically a zoonotic, but there can be some transference of salmonella, for example. So I feed my dogs some raw food, but also put some kibble in. The stuff that I get ends up being frozen, and it's microwaved to thaw it out. That's still not enough to kill that off, I would assume, or is that safer?
Well, we used to think that if you freeze it, it kills all the bacteria. We know that's not true.
Yes.
It may kill a few of the bacteria, but not very many. It depends how long it's in the microwave. So somebody would have to do a study to see. There's also freeze-dried raw foods available, and that doesn't kill all the bacteria.
So what do we do then? Because there's some people who are just going to keep doing this. I know that you're not a big fan of it, but like you said, it's popular and people continue. So how can you mitigate some of those dangers?
So you can mitigate the dangers by making sure that the food bowl is taken away as soon as the dog is finished with it. You can make sure that be extra vigilant in cleaning up poop and stuff in the backyard. You don't want to leave it out there where a kid could fall into it and get contaminated. So you just need enhanced infection control, basically. So just try your best to clean up as well as you can. But it's again, luckily, most people that are feeding raw food, the dogs are perfectly healthy and they never have an issue. But there are more and more of these issues being identified, and so there's no way to completely mitigate the chances of getting an infection.
Once again, any of you watching, you want to throw in a question, now's a great time to start doing that. Just talk about, we in a lot of the sessions, we've talked about having an animal health protocol. So that's been included with the beef industry or pork or poultry or larger commercial manufacturers or producers, that having an animal health protocol gives a plan for the whole herd or flock or whatever they have. That's still an important thing for individual pet owners as well. If you don't have a plan, or at least know how you should be sort of navigating the health of your animal, then you could get into trouble. So would you advise some kind of a plan or protocol?
Definitely I would, and you're 100% right. It's not a flock or a herd medicine like it would be with food production veterinary medicine. It's more like human medicine, right? And when you sit down with your GP, they say, okay, well, I'd like you to come in and we're going to do this at this time of year. You're going to get this done at this time of year. We're doing this blood work at this time of year. So with your veterinarian, based on your pet and their age and their risk level for certain diseases, they should map out an individual healthcare protocol for you. Now, luckily, for the first many years of their lives, it's probably just going to be come in for your annual physical exam. Then as they get a little bit older, they'll say, well, let's do blood work and a urinalysis every year looking for other things. When they get a little bit older, let's start taking some x-rays to see if there's any arthritis or any pathology in their lungs going on. So that would be the protocol, because as you said earlier on, it's much easier to prevent things or identify them early and manage them than to wait until they're very sick and it's hard to do anything about it. I like to talk about proactive medicine and reactive medicine. Mm-hmm. In proactive medicine, you try and identify things early or prevent them completely. In reactive medicine, you wait until they're sick and then you try and get them better. Well, obviously, the patients handled with reactive medicine are not likely to do as well for as long as dogs and cats that we do proactive medicine.
You know, a lot of people worry about the bottom line. They love their pets, so they'll do anything for them, and virtually sell the farm in order to take care of the cat or the dog. But at the same time, these days in veterinary practice, you guys have so much more equipment, so many more diagnostic ability. All of that stuff ends up costing money. So where do you draw the line, or how do you draw the line between what we can do for a pet and what we should do? So like the real world versus, ideal world, I suppose.
Yeah, and what's happened in veterinary medicine, and I'm very proud of this, veterinary medicine our clients pushed us. They said, we want higher level care. We want higher level care. And we've done that to the point that we're almost practicing the same quality of medicine that they're practicing on the human side. I work at a referral center where we have an MRI, a CT scan, a fluoroscope, multiple ultrasound machines. Yeah. We have specialist surgeons, we have a neurologist. But what happens with that level of care is the price goes up, and that because the overhead goes way up. But you're right, the cost of veterinary medicine has gotten significantly higher because the standard of care has gone so high. But what we have to do as a profession, we have to realize that not every client can accept our recommendation. If I tell you, well, I need to do an MRI on your dog, well, you might not have $3,500, right, to do the MRI, and I shouldn't embarrass you because you can't pay for that. So we have to offer other levels of care without judging at all, because different people have different abilities to pay for care. They have different pet owning philosophies as well. And not everybody wants plan A. So what we need to do is offer best medicine. I always say we have to offer best medicine, but if that's not attainable, then without judgment, we have to offer, okay, this is plan B, this is plan C, this is plan D, and we have to work with each of our clients to find what works best for them and their pet.
Yeah, and those can be some really tough decisions for some people as well. But that's part of the reality of being a pet owner is you do the best you can, and as long as you do the best you can to your ability, then you're doing a solid job, I think. Anyway, we do have a question coming in from Kimberly. Thank you, Kimberly, for this. And I'm not familiar with this, so I'm hoping this will twig on for you. So she's asking if Dr. Joffe could speak to alternative vaccine schedules for certain breeds. Does that ring a bell for you?
Well, there's a lot of interest in that, and we have changed the way we vaccinate. When I graduated, it was you got 3 shots as a puppy or a kitten, and then every year you got your shots. Now we realize that a lot of the vaccines last for longer than a year, so a lot of veterinarians have gone to 3-year protocols, so they'll give their routine vaccine at the 1-year checkup, and then it's every 3 years after that. And others use titers where they can find the level of immunity, though it's not perfect doing it that way. And only when their titers start to drop, that's when they'll vaccinate. I don't think it's specifically it's not breed specific in that case, but certainly if clients have worries, then they need to talk to their veterinarian to see how they can massage these protocols and find one that works for them and their pet.
Okay, and we still have an opportunity. We are running out of time here, but we still have an opportunity for a few more questions if anybody wants to pop them in. But I just wanted you to take a moment and, within this whole discussion, we've talked about cleaning dishes and stuff. There's a larger biosecurity issue. Is there not? When we talk about the major commercial livestock producers, biosecurity is huge for that kind of thing. Do we need to worry about that kind of thing in our own homes with our pets? And is it fairly basic, or what can we keep in mind for trying to ensure that kinds of diseases don't come into our house?
Yeah, and another zoonotic disease that's very common from pets. Luckily, we don't see a lot of it in Alberta because of how dry our environment is, but ringworm is one of the more common diseases where we have to watch. That's when if our dog or cats get it more commonly than dogs, but cattle and horses get it more commonly than cats. But that would be something that if there's people getting ringworm lesions in their house, the cat is number 1 culprit, dog would be number 2. We have to find out if it's there. If it is there, we have to decontaminate and treat the pet. But one of the things that we know about kids and pets, and especially kids in urban areas with pets, is that actually a little bit of the dirt seems to help a little bit. Allergy levels are much lower in children that have had 2 or 3 pets in their home with them, and even lower in children that have grown up in rural communities. Yes, dogs and cats are not as fastidious as people are, and they do carry some bugs, but a little bit of that might actually be good to keep our immune systems healthy. So I don't think I know people every time their dog comes in from the outdoors, they wipe them down, they clean them, they do, because they want them to be as clean as the people in the house. We're never going to accomplish that because that's not their lifestyle. But I don't think people need to lose sleep over everyday things with their pets. They're not going to bring in anything that serious. Raw food is the one thing where I would say that's maybe not the case.
Okay. Well, overall, that's good news, because as we were looking into getting our Great Danes, one of the things we saw on a website was, do not get this dog if you are a fastidious housekeeper, because with those feet, they bring a ton of stuff into the house, and sure enough, they have. Okay, I want you to just think for a few moments as I set people up for what's coming up next week. Just think of a takeaway that you want people to have after, as you came into doing this session. What was what's the one thing that you wanted them to have come out of this? Above all. So I'll let you ruminate on that for just a quick second. We're going to have our final session next week, Thursday, November the 5th, and it will again be at 7 o'clock. We'll be talking about small ruminant animals, so sheep, goats, llamas, and our guest at that time will be Dr. Lynn Tate, and she will be wrapping up our Raised with Care stewardship sessions next week on Thursday evening. Okay, so I've given you a few moments. What's the one takeaway you hope that people get from this session?
Well, the one takeaway is that I think more and more our pets are members of the family, right? Used to be they were in the backyard, then they came in the house, now they're in our beds, and they're a member of the family. And I think that we should be able to offer them the same level of medical care that the rest of the family gets as well. That said, I do want to emphasize that we understand, as a veterinary community, we understand that not everybody can accept option one. Your veterinarian needs to work with you in those cases. And like I said before, open-mindedly work with you and figure out a level of care that works for you and your pet. But again, they are a member of the family, and we want to treat them as a member of the family. All
right, Dr. Joffe, this has been great. Thank you. I appreciate. Oh, hang on. We just had another question pop in. I might as well go for it. And I know this isn't your specialty, but I was a little curious of this heading into talking about vaccinating reptiles, for example, bearded dragons or whatever, because then people obviously interact with them as well. There must be vaccinations for reptiles as well, I would think, aren't there?
Not that I know of, but as I said, the last time that I read anything about reptiles would have been when I was studying for my final exams 36 years ago. Yeah, so I'm going to let myself.
But you can certainly you call vets, and that's also important too, to make sure that you target your veterinary care with people who are specialists or well versed in certain areas that of the type of animal you have, right? So if you have a reptile and you take it into a regular dog and cat vet, you might not get the same kind of service that you might be hoping for. That'd be fair, wouldn't it?
Yeah, 100%. And I'm glad you brought that up, because there are, in companion animal practice, there are practices that just do avian and exotic. That's all they do every day. There's some just pure avian practices, pure bird practices. So you want to, just like when you're picking a doctor for yourself, you want to find somebody that is able to take care for your pets. And if somebody phoned me and said, "Can I bring my bird in?" I'd say I would not want you to do that, because you know more about your bird than I do. But there's lots of colleagues out there that could do, and either through Google or we usually if you phone your regular clinic and they don't see those other pets, they will be able to give you the names of some clinics that do.
Perfect. Dr. Joffe, it's been nice talking to you. Thank you. I appreciate it. We can actually have the lights go out now, and it's not going to bother anybody. It'll be perfect.
Perfect. Thanks for having me.
You bet. Thank you. Cheers. Once again, our final Raised with Care stewardship session for this fall series is coming up next week, Thursday, November the 5th at 7 p.m., talking with Dr. Lynn Tate about small ruminant animals, sheep, goats, llamas. If you're interested, hope you'll join us. In the meantime, tell your friends about these particular sessions, and you can access them through the raisedwithcare.ca website, all of the ones that we've done so far. Once again, thanks for watching, and we'll see you again shortly.